Also in the auditorium, Tony Hall. I improved international orthopedic last few years. I will not teach you, I will inform you about our journal, because you know International Orthopedic is official journal of CICOT, and I will show you one part of my report in editorial board meeting, which will be held in Paris in November this year. As you know, International Orthopaedics is a member of a big family publishing company, Springer. And this is not advertisement for Springer, only to show you augmentation year per year of published journals and e-books. I can recommend, I cannot say all of us, but especially young colleagues, to consult this web page of Springer. A lot of things that we heard it this morning you can find also on this web page, and you can go on, you can go directly to Springer link, or you can go through the Google. Thanks to computer era and thanks to Springer's technology, we can know about our international orthopedics day per day. For example, on these slides, downloaded papers, how many papers were downloaded, and also the names of the papers, and you can see actually the most loaded papers from International Orthopaedics 2 weeks ago. And you can see that it is femoroacetabular impingement is very popular topics today. What's about distribution of the journal? You know, today more and more distribution or more and more institution prefer to have the journal online. We can be satisfied with the number, with the distribution of our journal. Only I'm not satisfied with this number of society members, but it must be something wrong, because we augmented the membership, but not yet distribution of our journal through the CICOT members community. Regarding full text downloaded articles, as you can see, from 2007 to 2010, it's doubled. Top 10 articles downloaded. I was interested in my career with knee surgery, sports medicine, and I am very satisfied. You can see the first 5 articles downloaded are about knee. Knee is very popular, and now by geography, Asia, Pacific, and Europe, regarding the downloaded full text article requested, and also North America augmented the percentage of requested paper from our journal from the people from North America, augmented. It's important for impact factor also. Submissions, like in a Journal of Bone and Joint Surgery, British volume, this year, 2011, I expect about 1,700 papers. In GBJS it is 2,000, as I heard it. Geographical breakdown of submitted paper now we're talking about submitted paper. You can see Asia on the first place, and then Europe, etc. But we talk now about submitted paper, and later I will show you percentage of published paper. The situation for published paper is different. Geographical breakdown of submitted paper last year by country. So China on the first place, and maybe I will stop few seconds to you can see where is your country in this and maybe it will be stimulation for you to stimulate your colleagues to publish in International Orthopaedics. Regarding acceptance rate and rejection rate, 2009-2010 acceptance rate is 23%. In GBGS British volume, this is 18%. I think that we will also diminish this acceptance rate, and that it will be 2011 about 20%. And now, origin of papers published by continent. Now Europe is on the first place. Regarding submitted paper, it was Asia Pacific, but now by published papers, this is Europe. And again, by countries, country by country, China is always on the first place regarding submitting papers and regarding published papers. And when I saw 2 days ago during opening ceremony 100,000 orthopedic surgeons in China, it's normal that they are on the first place. And colleague from China, they like the International Orthopaedics, and really they sent maybe too much papers to us. I don't know what's about GBGS. Okay, paper published more and more every year, and now the time peer reviewer times it's 2 months, the same like as in GBGS, but I'm not, and from the acceptance to the to be published online is about 1 month, and after that it's a long time to be published in printed form. But we do in editorial board our best to improve this situation, and actually last year it was 11 months from receiving one paper to be published in printed form, if it was accepted, of course. And now impact factor we can discuss later, maybe with Frank Horan and James Scott, about impact factor. But you can see, we can, in International Orthopaedics, we can be more than satisfied, because we are very close to Acta Orthopaedica, and maybe in the future we will be closer to, in my opinion, the best general orthopedic journal. This is Journal of Bone and Joint Surgery, British volume. I don't say because Frank Horan and James Scott are here in auditorium and our speakers, but you know, in my opinion, GBGS British volume is the best general orthopedic journal, but not with the highest impact factor. This is the difference between if one journal is impact factor is only one index for one journal. Yes, also in International Orthopaedics, number of citation, number of source items augmented significantly, as you can see. Rank 2009 we were 18th, now we are 25, but and if you look at this titles of these papers, then you, if you remember the most requested paper and the most downloaded paper, it's a difference in between this paper on these slides and the paper the most downloaded. That means this is this paper on these slides are more scientifically, and the others are more practically paper. And finally, our impact factor and the ranking. You know that last few years journal citation report also show us 5 years impact factor. Also, I think we can be satisfied with this situation. Springer, the marketing, for the marketing is responsible Springer. Springer prefers online marketing, but also during the congresses they do something for us and for our journals. And in the end, this is the picture of editorial board of the last meeting held in Ljubljana. Host was Professor Vane Antolić. He is also here, I don't know in auditorium or not, but I would like to thank all these people, and especially I would like to thank Tony Hall, who is associate editors. He helps me enormously, tremendously. And in the end, I would like to say that I am member of editorial board of International Orthopaedics now, I think, I don't remember exactly, but 16 or 17 years. And when I started as assistant editor, chairman of editorial board was Frank Horan, the associate editor was James Scott, and the other associate editor was Tony Hall. He's always associated editors, and I learned tremendously of these gentlemen, and if we improved our international orthopedics, this is also thanks to them. I learned a lot of from them, but not English, sorry.
Well, thank you very much, Marco. I think the International Orthopaedics has come on apace, and it's very interesting to see the widespread of geographically of these things you get. When I read your journal, which I do regularly, that always impresses me, and I think you've done terribly well with it. Now, ladies and gentlemen, if you're not all asleep, we could perhaps discuss matters. If chaps would like to come up here, if you'd like to ask James or Marius or Marco anything about publishing or writing, we'd be very pleased to answer your questions, hopefully, with some sense. James, you've fallen asleep. Oh, you're here. Oh, my dear chap. You're so small, I missed you. Right, please, first question.
I'd like to ask about reviewing.
Yes.
How would you approach an article submitted with a title like this? Representation of a disease, case report, and literature review. So whether you accept that type of manuscript.
Well, you heard my views on case report and literature review. We don't like the literature review. But James, who's the editor now, could perhaps answer you on current thinking, James. I don't know whether this comes off, or you go up there, I suppose.
I'm ashamed to say I rather like case reports. We're always criticised for publishing too many. I think if you have a general orthopaedic journal, you need some fun in there somewhere. And most case reports are fun. And a good case report has a very good illustration to it, with an X-ray that, oof, heavens above, look at that. And I like that sort of thing. In general, of course, when you're choosing case reports, I mean, as a reviewer, you need to have the same criteria. Have I learnt something about this condition from this case report? Am I going to do anything differently? Is the controversial aspect being addressed? And, I mean, you need to remember that there are some conditions within our speciality that were first described as case reports. Various forms of compartment syndrome, for instance, first came as case report. So I think that we need We need case reports. I feel that our journal needs case reports. I personally don't like literature review, rather like Frank. I think there's a place for 3 or 4 sentences. I'd rather, as we were talking about the discussion, placing the information that you presented before the reader in this report into context. And that's all. A review of the literature very rarely advances the message that you are trying to impart with a good case report.
I think with the case report, remember that we try and make journals attractive. We like to see a page which will stop the reader and they are attracted to it. Now, of course, case reports will do that, particularly if they're well illustrated. All journals have limited space, so one has to place articles in appropriate sections, and therefore case reports you like to be reasonably short, so perhaps 2 pages with illustrations will do. Next, sir.
Thank you. My question is regarding the size of a study. Especially when you're doing a prospective study. So how do you decide that you now have sufficient number of cases to go ahead with the publication?
The straight answer to that is you get a statistician to calculate the power of the study required to evaluate whatever it is you're assessing. You must get a view from a statistician, in my view.
What are your thoughts on the report of performance metrics in the methodology of a paper comparing 2 surgical techniques? And do you feel that for the reader it can help in assessing the reliability and reproducibility of the results?
Thanks, Ice. It's a very big issue. In general, when I'm going to come to answer you, when we rewrite papers, which we do, all papers get rewritten, we shorten all aspects of it, except the methodology. And increasingly, I find that you want more of the methodology, and you want it to be very clearly explained where the outcome studies come from, if they've been validated, as I was saying, and what other ones might have been available and why you didn't use them. Why you particularly chose, in the design of your study, the performance metrics that you have suggested to me. And of all the aspects of the reporting of literature, of papers in orthopaedics, that is the one, I think, that has gained the most benefit from evidence-based practice. Personally, as you know, but when it comes to looking at a journal, I don't like evidence-based. But I think that the evidence-based movement, which is very, very powerful and coming from Canada, has done an immense amount to focus our minds on methodology. And the reason why papers are better now than they were 4 or 5 years ago is because much more attention is paid to performance metrics, I think.
Yes, to Dr. Oren, I heard that you said you didn't care about the impact factor. Does that mean if I really want to have my paper published in your journal, it doesn't matter if when I keep my citation of reference to a minimum, that I don't cite a paper from your journal? And you can give me an honest answer, and I promise you that the answer will stay here in the room.
Well, the answer to that, of course, is we're aware of our impact factor. When the papers have reached the stage of acceptance and the editor or associates are rewriting it, plainly, if the references in our journal over the previous 2 years, which are appropriate, we would contact the author and say, may we include these references? Because as you recall, the citation index is on the last 2 years. Marco, would you have to say?
I do the same, and I'm really disappointed. I am really disappointed when we sent me, International Orthopaedics, one article, and a good article, and for example, you don't put one reference from International Orthopaedics, and we published last 2 years in International Orthopaedics very similar topics. Then, after acceptance, I do the same. I contact author. Please, could you add some reference? And that me, I'm going to what is in my English? I suggest the author's names, volume, issue.
You write it in there, Mark. Yeah. So, next time, gentlemen.
question like I have a new method I'm doing, then I got a new result. So shall I send both separate or shall I keep everything in one paper? Shall I slice my paper or is it better for the paper to keep everything, which I thought it's too big for one paper?
Well, first of all, you need to look at the instructions to authors very, very, very carefully, and it's amazing how few authors do. Very, very, very carefully. In general, of course, the whole study, if it fits within the word content that is applied, is much, much, much better. Dividing things up doesn't work, and it brings in aspects of, well, not fraud, but malpractice. So long as you... What I feel very strongly about this issue of salami slicing is if you say straight away in the introduction that you have previously published on this subject, this issue, or you have previously submitted a paper, the conclusions of which you say, we now wish to look at, so that the readers understand that the first material was too large, you couldn't draw the conclusions that you appropriately wished from that material, so you divided the study up into packages. I think that's perfectly all right, so long as you are absolutely upfront with it, and you tell the reviewers and the readers why it is that you've divided the study up. But in general, the whole thing... What I don't like, and we have, I'm afraid, banned authors in the past, I don't like being submitted the clinical outcome of a group of patients, and then a year later being submitted the radiological data or something else, and we don't like that. That's not right.
Another question, like JBGS is a general journal. If I'm doing a very nice pediatric orthopedic or hand surgery study, shall I send it to JBGS as a general journal, or shall I send it to put an ankle or hand?
You need to take a view about which journal is most appropriate. We publish some very good and interesting pediatric papers. We get sent lots. And for a general orthopaedic surgeon, we simply have to take a view as to whether this piece of information for a general orthopaedic surgeon is of interest. If it's too specialized, you know, if you're talking about the tilt of the talus in recurrent club foot, that would be much more of interest to a restricted specialist paediatric community. You need to take that view. I mean, I'm happy to take it for you, but primarily, where you send your paper is for you to do, and you need to look at journals very carefully. And the thing that I cannot impress upon people too much is that you need to be familiar with the literature. You need to read things in the way that I've been describing. So you're wholly familiar with the literature and familiar with the way in which material is presented. It'll then be obvious to you whether our journal is the most appropriate journal to submit that. Familiarity is it.
Please.
I have studied fracture pelvis, and I was looking for the evaluation or scoring system that will be validated, but I could not find it in the Harris scoring system or so on. Can I invent my scoring system, and how can I validate it so that you accept it?
Well, that's a roundabout question, sir, isn't it? First of all, we always view with considerable suspicion yet another scoring system on yet another part of the anatomy. So if you can produce a study which has been decently validated, and you can validate your own study and show that the scoring system you use is appropriate, well, that's fine. But you really do have to get that very clear. Otherwise, I think your paper may be sent back and saying, well, have a go somewhere else. Yeah.
The people who describe outcome studies after pelvic fractures use lots and lots of different scoring systems, and they usually use a general rather than a disease-specific outcome study. And you simply need to look at the way in which the outcome after pelvic fracture has been recorded and take a view about where you stand in relation to their outcome studies. That's all. If you want to start your own, yes, absolutely.
Yes,
take you a long time.
None of them are terribly satisfactory, James,
no,
are they? No. Sir, please.
My question is, I'm from Nigeria. A lot of times, people are not encouraged to submit the articles, which most of these international journals, because sometimes they get rejected.
Yeah.
Oftentimes, it's simply because we have a lot of challenges in the developing country. We have high workload. For instance, in my country, we probably have about 300 surgeons taking care of almost around 20 million population. We have high workload, and then how do you combine this with so much you put into how to write the paper, getting appropriate ones? And oftentimes, because you have to write these journals with process before it gets published, people don't get really encouraged into writing because oftentimes they get rejected most of the time. I just want to know whether you give special consideration for developing countries on journals that are coming from them. Secondly, from your experience here, senior curriculum, how do you have advice on how to balance the workload with practice?
Well, we can't answer that in how you balance your workload. But about 8 or 9 years ago, I looked at the acceptance rates from countries worldwide in the percentage acceptance. And as you hear, ours is between 16 and 18%, depending on the year. There was no difference at all, which surprised me, between individual countries in the percentage of acceptance of the papers. So I don't think, I'm not aware of any country bias. But as far as your particular set of circumstances are concerned, which I appreciate, you've obviously got a lot of material. I would suggest that the way you look at it is to take a particular aspect, work at it, get a paper up. Don't necessarily send it to us. Send it to a lower, how would you put it, a less popular journal where your chances of acceptance are greater. And remember that if we reject a paper, you will get a resume of what we think was wrong, where you might send it, and how we think you might improve it.
It comes back to the issue of familiarity. You need to be familiar with the material that is put into the journal in which you're going to submit. And we have published some very, very, very interesting material from the African continent, and more of it. And if you think your work is appropriate, send it to us. It's very straightforward, familiarity.
I just managed to publish in textbook before journals because I have few book chapters on new technology for renal placement, which is patient specific rating. And I want to now submit it to your journal. So there are some like case examples which are already published in the book or in the book chapter. So how do you accept some of the material from a book chapter and go inside?
Are you talking of illustrations or text?
Some cases, not complete series.
I think James better answer that.
Well, the illustrations, that is a copyright issue. So we need to determine that, but you need to tell us where they were published and who the publisher was, and then we either have an arrangement with them or we don't. And if we don't, we would ask them. When it comes to text, the same thing, broadly speaking, applies, only we need absolutely to be told where this information has been published before, so that readers can take an opinion about how it is interesting or useful to them for it to be done again. I mean, because, of course, increasingly, and you heard us say, we do more instructional material. And some of that has to have been in the public arena before. And that's fine. But the reader needs to understand where it has been in the public arena before and how it is available to them, if you like, if there's web-based information or through which journal. You just need to explain. Yes,
and permission.
Yes, that's all.
Sir? Next.
When we send the manuscript back, revised manuscript, do you send it to the same reviewer who reviewed it for the first time, or do you send it to a different one who will review it completely?
James will answer that.
It wholly depends on how much work has been needed. If very little work has been needed, I wouldn't send it out to anybody again. I would just see whether the appropriate changes had been made and publish it. If it has been substantially changed in the ways that the reviewers wished, I would send it back to them. If it's very controversial and alarming and difficult, I would bring it to an editorial board meeting. We have those 5 times a year. People meet and discuss papers, and then it would go to them. It's a complicated...
Do you recommend taking professional help, for example, for the language or the statistics right from the beginning, or should advise later on in the revision?
Certainly, initially, statistical and epidemiological advice is increasingly essential. When you're designing your study, you need somebody to tell you what the appropriate statistics are and what the appropriate methodology is. Very, very early on, I think.
We don't bother too much about language. Realizing that half of our papers at least come from people who do not have English as the first language. What is necessary is that the ideas are expressed sufficiently clearly so that they're understandable to the reviewers, because we rewrite virtually everything. So you wouldn't recognize your paper, perhaps, when it eventually appeared in the journal, but the substance of your argument would have been expressed in a way which we think is more likely to be understood by our wide readership.
At the end of the day, it is simply whether the science is good. And if the science is good and it's unintelligibly written, we would rewrite it. As Frank says, we rewrite all papers, I'm ashamed to say. So the language, don't worry about the language.
Dear colleague, don't worry about English. You see, my English is not perfect. But in Springer, do the first correction, and the last correction is by Tony Hall, Oxford English. And Tony does not only English correction, also last professional correction. And he asks me, what is this? What reviewer did? No, don't worry. But you have also on website of Springer the possibility to send. It depends of the money to send and for the help.
Please.
I'm just wondering why wouldn't the author granted the right to discuss his own point of view about the reviewer's comment? I mean, this is because I sent a paper somewhere and the reviewers it was rejected, and the reviewer's comments, I felt it bear no relation with what I was saying. If I couldn't write what I wanted to say, why did it pass the editing stage? So,
well, that's a question, of course, which is frequently raised. And when I was editing, James is much more kind than I am. My view was simply that if the idea was not expressed sufficiently well for the reviewer to understand it, you'd miss the whole point. And you would have to start again. Because the reviewer can't guess what's in your mind, and he may get the wrong side of it, and I take your point, but it's unlikely that 2 or maybe 3 reviewers will all get it wrong. And I used to have a standard answer to say that if you feel the reviewer's not understood it, perhaps you've not expressed yourself clearly, and have another try, and then we will have it re-reviewed. We do appreciate the difficulties of people writing in languages which they're not familiar. And it's a considerable problem. But on the whole, it works reasonably well. And we never feel that people should be in any way frightened or reticent about sending their papers to us because the language isn't good enough. As long as the idea comes over.
Can I just add something to that? I absolutely love it. There's nothing that gives me more pleasure than a cross-author. Absolutely wonderful. Your reviewers know absolutely nothing about this subject. What are you doing in your journal? I love that. So then I write to the author and I say, fine, send it out, send it to me again, underline the bits of the review that were wrong, and we will discuss it. And then I either go back to the reviewers, because reviewers make mistakes. I mean, and we do our best, and maybe sometimes we don't choose the best reviewers, but a cross-author is absolutely wonderful, golden. So if you're angry, you write to me and you say, I simply can't understand how you rejected my wonderful paper. And then I look at it and I see if it's wonderful and the reviewers have made a mistake, I send it out to be reviewed by another couple of wonderful reviewers. Or we take it to the board. Reject it, even if it's rejected. And it is occasionally true that rejected papers, when resubmitted, have been accepted. It happens. Of course, we all make mistakes, and it's all part of the wonderful fun.
The very best thing we have is papers submitted from the UK or Canada. Get rejected, and the author brings up and writes, says, I know who reviewed that, and he's a bitter enemy of mine. So we take no notice of that. Any more questions, or shall we stop? Thank you very much for coming, ladies and gentlemen. I hope you had a good morning.
You were very kind. You were very kind. Very supportive.
Great pleasure.
That was good fun, wasn't it? I like talking about journeys, you know.
Yes.
Can I ask you?
Hello. No, well, not at all.
Yes, by all means, yes. I'm not very photogenic, but you're very welcome.
I'm afraid we may be sending you too many pages.
I'll tell you.
Please, send them back.
But I actually had an experience of really